If your legs feel tight, heavy, or just plain stuck, this video is for you. I've gathered my favorite lower body stretches, the ones that I use as well as the ones that I teach my patients, to help you relieve tension through your quads, hamstrings, calves, and IT band. So grab your mat, find some space, and let's get those legs feeling good again. Because movement is life, and it's all connected. Are you tugging on your hamstrings, hoping that one day they will finally loosen up, but only finding yourself with potentially more pain and maybe even low back pain? Let's talk about what's happening and how to fix it. A lot of people realize that they have tight hamstrings or the muscle in the back of your thigh, and they are struggling to figure out why after stretching it and stretching and stretching it, the motion in the hamstrings is not improving and the tension may actually be getting worse. And listen, I understand it's important to keep your hamstrings as flexible as you are capable of. However, when the tension is increasing, we're heading in the wrong direction. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life, and you deserve both. First off today, we're going to talk about why you should be stretching your hamstrings, as well as who should not be stretching their hamstrings. Then we're going to go through several different hamstring stretches so you can find the one that works best for you, as well as talking about the one that is commonly used on YouTube that I am going to ask you to avoid. And I'll explain more when we get there. All right, first off, why do you need to stretch your hamstrings? It is critically important to stretch these muscles because they attach to the pelvis. So if you put your hands on your hips, that is your pelvis, and your hamstrings actually attach to it, which means if they're tight, they're going to tilt the pelvis. If they tilt the pelvis backwards, it makes it harder to sit up properly or stand up properly, and makes it more difficult to literally do every single activity that you're trying to do. So the hamstrings run from the pelvis down the femur or the thigh bone and actually attach below the knee. So if you put your hands on each side of your knee, you'll feel like these ropey tendons in there. That's actually your hamstring tendons. So they travel a long distance and they can cause a lot of problems. Tight hamstrings can make it really difficult to walk correctly, to bend forward, and they can even make sitting really difficult because it can be hard to get in that proper position, which can lead to things like low back pain. However, stretching improperly can also lead to back pain because it irritates the low back, or worse yet, it can even cause sciatica. And I do want to say, if you're watching this video to learn how to stretch your hamstrings because you are suffering currently with sciatica pain, please do not do that. I do not recommend stretching the hamstrings when you are going through a sciatica flare because it will actually stretch the sciatic nerve as well. And what will happen is the nerve will become more irritated. Now, I know when you do the stretch, it will feel much better and you'll be like, oh, that really helped my sciatic nerve. But let me tell you, it will come back with a fierce vengeance. And that's not what we want for you. So if you are suffering with a current sciatica flare-up, please do not watch this video any further. Go watch one of our sciatica videos instead, where we discuss the importance of not stretching your hamstrings while you're having an active sciatica flare. And that would be the biggest reason I would say to not stretch your hamstrings, is because of the importance of not aggravating the sciatic nerve. So some people will feel like they have this tension down the back of their leg, but it's actually a nerve tension as opposed to a hamstring tension. So how do you know if this is you? Well, if you have sciatica, so you have that sharp stabbing, shooting pain going down the back of your leg, then yes, you have nerve issues, please don't do this stretch. However, if you do these stretches and after you do the recommended dosage, you actually feel like things are tighter, then chances are that you are actually having a nerve irritation and you have stretched that nerve and it does not like it. In that case, if you do not feel better after doing these stretches, and you believe that you have that nerve tension, then I would highly recommend putting this video to the side for about a month or so. Then you can come back and try it again because that nerve could be calmed down. But we do not want to be irritating the sciatic nerve. I mean, we don't want to be irritating any nerve. And what we know for sure is nerves do not like to be stretched. All right, our first hamstring stretch we can do in sitting. Now, this is a
a rolly stool, which is not the recommended one. It's just what I happen to have on hand here. I would recommend you do it in something more like a kitchen chair or something with a firmer base, but we're going to pretend like I have a nice firm base here in front of me. So what you're going to do is you're going to put one foot out, the other foot is going to be back here for support, and you're going to bring your heel down and your toes up towards your head. Then what you're going to do is you're going to hinge through your hip bones. Now what I see a lot of people do is they'll try to bend through their back. This puts a lot of pressure on the low back, and this is not what we want to do. So if you need to put your hands on your hips, it can be really helpful to feel where you're moving through there. Whereas if you try to bend through your back, you're gonna be like, well, that doesn't feel like it's moving in the right spot. So I like to put my thumbs on my hips to make sure I'm in the right spot. You also can use this to make sure that your pelvis stays neutral. We don't want the pelvis to be rocking back and forth or anything like that, because we want to make sure we're getting that pure hamstring stretch. So I like to put my hands on my hips so I can feel it, and then I'm going to hinge through my hips as if I'm trying to stick my booty out behind me. And my left hamstring is nice and tight today, so I can already feel that stretch really well right here. You're going to hold it for 10 seconds, and then you're just going to sit up and release it for 10 seconds minimum. Now, if you're sitting and you can just do the other side while you're resting, that's fine too. You can put the other leg out straight. Make sure our hips are nice and stacked. Our thumbs are on our hip bones to make sure we're getting that nice motion. Now this one, yep, you'd think I'd go a little bit farther on this side, but not really, not that much further. My hamstrings are nice and tight today. So you guys get to see what they look like. And I'm gonna hold that for 10 seconds. And then I'm gonna switch to the other side. Since I'm just sitting, I can just switch pretty easily from side to side. Now this is a great stretch to do because you could do it potentially even while you're sitting in your office chair. If you're sitting in an office chair, you do need to make sure you scoot towards the front. Okay, you can't be really deep into an office chair. It's just gonna be really hard to get that correct straight leg. It's also going to be difficult to make sure you're hinging through here. So you just need to be sitting more on the edge of the chair so you can bring that leg out straight, heel down, and then be able to move through those hips. You're going to hold it for 10 seconds and you're going to do 3 reps on each side. Now, if you're just starting stretching your hamstrings, or maybe you don't have a good chair that you can use to do the previous stretch, I'm going to show you my favorite hamstring stretch, especially for people who are starting out. I recommend that you get a stretch strap. I'm going to put a link below in the description box of this stretch strap because I think it's a really good one. However, you could also use a beach towel or a belt to do this stretch. This one just makes it a little bit easier. The reason why this is my favorite stretch is because your spine is in a super safe and protected position while you're doing the stretch. And it makes it really easy to keep that safe supported position during the entire stretch. Now, I'm going to do it on the floor. However, you can do it on your bed as long as you don't roll around on your bed when you're trying to do it. Some people have a really soft, squishy bed and then they bring that leg up and they kind of like tilt over to the side. Okay, that's not going to work, but it's fine to do it on your bed as long as it's firm enough and you feel stable on it. All right, so here's what we're going to do. We're going to take our stretch strap, kind of find the middle of it. We're going to put our foot in the strap. Okay, so once you're down with that strap over the foot, you're going to put the other leg down straight. This is going to help keep your pelvis in that nice neutral position. Then what you're going to do is bring this up, and see, this is a nice thing about the stretch strap. It just holds everything in place. Then you can bend to bring that foot up to where you feel that comfortable stretch. Again, it's a hurt so good stretch. It's not a, oh, I can't breathe stretch. You're going to hold that for 10 seconds. And then you're going to bring it back down and let it rest for 10 seconds. Now, if I was using the stretch strap, I wouldn't then turn and go and do the other side just because it's kind of a pain. I would just hang out for 10 seconds and then I would get into the stretch again. However, if you would prefer to switch from side to side and use your rest to stretch the other side, that's absolutely fine too. You're going to do a 10-second stretch and you're going to do 3 on each side. So you probably know I'm going to talk about the doorway stretch. Now, if you don't know what I'm talking about, just go ahead and fast forward until you see the next stretch, because this is not a stretch that I want you to know about, nor do I want you to know how to do. However, it is all over YouTube as a way to stretch your hamstrings. And yes, technically, it will potentially stretch your hamstrings. However, a lot of people that I see when they come into the clinic and they show me the stretch, they're not doing it correctly, because it is very difficult to do it correctly to get a good, comfortable stretch and maintain it. But it's very difficult to get in and out of. And so it puts a lot of weird torque through your pelvis and your spine in order to get in and out of that position, which is actually my biggest problem with the stretch. The stretch itself isn't necessarily that big of a problem, although a lot of people tend to overdo it, and I get concerned about that. It's more getting into the position, and there's so many other stretches that are just way easier to get into. So I don't feel like you need to do the doorway stretch, and if you feel like, oh, I've tried stretching my hamstrings using the doorway stretch and it doesn't work, I'm gonna recommend you try one of these other methods. Okay, so now I'm going to show you my favorite hamstring stretch. This is actually how I stretch my hamstrings on a daily basis. If you've watched my videos before, you've probably seen me do this stretch regularly throughout them, because it's my favorite one. And it's what I ask everybody to do who comes into the clinic. So what you're going to do is you're going to find something to put your foot up on. I have a little bolster here, and that works just fine. If you're at home, you could put it on the first or second step. You can even use your car door jamb if you're like out hiking and you need to stretch your hamstrings or something like that. There's just something to kind of prop your foot up a little bit. A curb would work. Anything you have around, just pop your foot up a little bit. Then what you're going to do is you're going to put your hands on your hip bones. So these are your hip bones. A lot of people think up here is their hip bones. That's actually the ilium, that's your pelvis. I'm gonna have you put your hands here through your hip bones so you can actually feel that motion that's coming through there. Then keeping that leg straight, toes are gonna be back towards your head. You're going to stick your bottom back and bend, see, bending through the hip bones, sticking your bottom back until you feel that nice stretch down the hamstring. And honestly, I can even feel this one into the calf. You're gonna hold that for 10 seconds, then you're gonna release that for 10 seconds. Now, since I'm standing, it's pretty easy. I'm gonna go ahead and just switch sides while I'm doing my rest on that side. Make sure I've got my pelvis squared, my hips, my hands on my hips, so I can make sure that I'm bending forward properly, and I'm gonna stick my booty out and get that nice stretch down through my hamstrings. Now, as you can see, I don't have to move very far, and I am getting a nice stretch through my hamstrings. Everybody's different. So for some people, getting their foot up and then they put their hands on their hips, they just kind of go like that. That's enough of a hamstring stretch. And that's fine if that's you. And for some people, you know, you're going to be able to go way down further than I can. Just make sure that if you're doing that, you're not bending through your back. Okay. Because a lot of people will try to like do like this, you know, trying to reach, right? That ends up potentially causing some low back pain. So what you want to do instead, hands on your hips, stick your booty out. You can think about that while you're stretching. All right, so with all of those stretches, whichever one you choose, you want to hold for 10 seconds, rest for 10 seconds. You can do the other side if you choose to, and do that 3 times. So you want to do 3 sets of 10 seconds. Now, there are some common mistakes that I want to make sure that you avoid while you're stretching your hamstrings. The first one that I see a lot is that people either hyperextend their knee or really lock their knee out. And although we want a straight leg, we don't want it to be hyperextended. So if you are someone who's super flexible, you may need to have what feels like a slight bend in your knee to make sure it's not hyperextended. Another common mistake I see when stretching the hamstrings is that people will round their low back. Make sure that all of your motion is coming through your hip joints and not through your back. And a big one for all stretches, but I definitely see it most with the hamstring stretch, is that people will stretch so much that they have to hold their breath because they can't breathe while they're stretching. Please, friends, the stretch should be comfortable enough that you can breathe through it. In fact, often while I'm stretching, you may see that once I get into that comfortable position, I actually take a deep breath. With 10 seconds, you should have a chance to do a couple of deep breaths, which is what I'll usually do when I'm doing my own stretching routine. It's just a little bit harder to remember to do that when I'm on video, but I'll get a couple deep breaths in, and that's how I know it's time to switch sides. And the number one thing I want to make sure you avoid is stretching when you're cold. So you may be a morning workout person, like you roll out of bed and then you head to the gym or you head for your run or whatever your preferred activity is. And you feel like, well, I need to stretch before I do my activity. I'd recommend doing a light warm up first. So maybe it's a little 5 minutes on the treadmill, walking or jogging to get your muscles warmed up before you do any stretching. When you stretch cold muscles, that can lead to micro tears, which can compound over time. So I would definitely recommend not stretching cold and make sure you have a little bit of an active warm up before you stretch. However, in all honesty, I stretch after I exercise because those muscles are nice and warm, and it's going to be safer to get that really good stretch and not cause trauma or damage the muscle fibers. Now, you may be wondering, should I stretch before or after I foam roll? And friends, I'm going to ask you to not foam roll your hamstrings anymore. I know, it's another controversial statement, but you know what? Just try it for a month. If your hamstrings feel really tight and you've been foam rolling them and you're not seeing any improvement in their length, how about try stretching them for a month every single day without foam rolling, and then see where you are at the end of the month. Because every body is different, and maybe what your body needs is more stretching and less foam rolling. Because the truth is that stretching your hamstrings should help, not hurt. However, you do have to be consistent. So if you struggle with chronic hamstring tension, I'm going to ask you to do whichever stretch you felt was the best for your body today. I'm going to ask you to do that every single day. Try it for a month. And I believe that after a month, you will notice an increase in your hamstring length, which hopefully will motivate you to continue doing it for the rest of your life. Now, towards the beginning of the video, we talked a lot about sciatica and how you should not stretch your hamstrings if you have sciatica. If that resonated with you, I'm going to have you go check out this video over here. If you found benefit from this video, please give it a thumbs up and don't forget to subscribe. If your thighs feel so tight that it's difficult to bend your knee, you may even notice problems going up or downstairs because it just feels like the muscles on the front of your thighs are so tight and you can't seem to stretch them without hurting your knee. Then today's video is for you. Today's video, we're going to focus on how to properly stretch your quads, and we're going to give you a ton of different positions that will be safe for literally everybody. Not every stretch is going to be the best for your body, so we're going to give you a lot of different options. Try them out, figure out which one works best for your body, and then you can keep going with that one. I have a lot of people in my life, in the clinic, online, and in my family who simply don't know how to stretch their quads effectively. They have a lot of pain in the front of their thighs, either from working out or just from day-to-day life, and they don't know what to do because whenever they try to stretch their quads, it hurts their knees. And let me explain to you why that is. So you have the quads, which are 4 muscles, which are in the front of your thigh. So if you put your hand on your thigh, you're putting it on your quads. And those 4 muscles come together and they form the quadricep tendon, which goes over the kneecap and then turns into the patellar tendon and attaches onto the tibia or the shin bone. Now, all of this is really important because when you're trying to stretch the muscle, the quad that's on your thigh, it is also going to stretch the tendon, which is the one that goes over your knee. And this is why so many people, when they're trying to stretch their muscle, or end up aggravating knee pain that they already have. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life, and you deserve both. Now, I'm going to ask that you watch this video all the way till the end and then come back and try your favorite stretch, because although all stretches can be good, they may not be the best for your body. We're going to start off by discussing who should be stretching their quads, as well as who shouldn't be stretching their quads. And at the end, we're going to talk about how many reps and how many sets and all of that stuff. So please make sure to watch the video all the way to the end before going and trying your favorite stretch that we discussed here today. So who should be stretching their quads? Well, first off is anybody who has knee pain. If you have knee pain, you want to find a way to stretch your quads, but you have to do it pain-free, because if you're increasing your pain, that's not very motivating to keep stretching, right? That's why we're going to present you with several different options here today, as well as anybody who has thigh pain. So if you have pain that is in your thigh, so you can put your hand on your leg, that's your thigh. That means you have actual quad pain. So you do want to make sure that you stretch that muscle out. Now you do want to be careful when you're stretching. There's a difference between stretching pain, which is that feels good pain, and bad pain, or that reproduces my pain symptoms and I'm having a hard time breathing because it's so painful. But there's a third group of people that I hope are watching this, because it is really important for all of my athletes, and that includes my weekend warriors, to be stretching your quads. A lot of people will do exercise maybe on the weekends or even throughout the week, and they don't really spend a lot of time stretching. And although I admit that you can get away with that when you're in your 20s and 30s, as you start getting near 40, 50, and 60, that doesn't work anymore. You are gonna have to be stretching. So please continue watching this and start your stretching routine now if you haven't already, to make sure that your knees and your body stay healthy so you can continue doing the activities you love. Now, I do admit that there is a group of people who should not be stretching their quads. If you are suffering with instability in your knee, in that you feel like when you're walking, your knee literally moves around too much, then please do not stretch your quads, because chances are good that this is actually going to make your problem worse. If you have knee instability, and this can be either the knee cap itself is unstable, or the knee joint further in, which that would be in between the femur or the thigh bone and the tibia and the shin bone. If that joint is unstable, it could be that your quads are actually tight because they are trying to stabilize that joint. So if that sounds like you're like, I feel like if I stretch my quads, my whole leg's gonna fall apart, then this is not for you. You do not want to be stretching your quads. What you want to be focused on is really getting that coordination of the knee joint, getting those ligaments to tighten up and support it, so that then you can go back to your regular activities. So please, if your knee feels inherently unstable, do not try to be stretching your quads. Okay, to start off, we're going to start with the most gentle quad stretch. So this is the one that you want to do if your quads are really, really limited in their motion and you're having a really hard time being able to use more traditional methods. For you, what you're going to want to do is you're going to want to get a stretch strap. I feel like these are really, really helpful, because they have these loops in them that you can put your foot in, so it makes it a little bit easier. You could use something like a beach towel or a belt to help stretch your quads. That's fine. It's just going to be a little bit harder to loop over your foot. But if a stretch strap sounds like it would be good for you, I'm going to link the one that we're using today in the box below. Now, you might be able to do this on your bed if you're not able to get down to the floor easily, which a lot of people with quad tightness can't get down to the floor easily. So you can do this on your bed. I'm showing it here on the floor, but don't feel like you have to get on the floor in order to be able to do this, as long as you're on some surface that you can lay on comfortably. So you're going to take your stretch strap and you are going to put your foot through it. Then you're going to hold onto the ends while you lay down. And then the nice thing is you can just pull this up. So you're pulling your foot towards your bottom. Now, the great thing about the stretch strap is that if you don't have that same level of flexibility, you can have it further back here. You could even just do it with one half of the stretch strap if you need to, as opposed to using both sides of it. But you're going to hold it here where you're feeling a good stretch in your quad. You're going to hang out for 10 seconds. And then you're going to release that stretch for you. Again, everybody's different, but I feel like this is in a relaxed position for my quad. So then I can stay here hang out for 10 seconds, and then I'm going to do that stretch again. Now you do want to be careful when you're in this position, because what we don't want to do is have this like huge arch in our low back. In general, that just doesn't feel good for people. It doesn't really affect your quad stretch. It does a little bit. I'm not super concerned about that aspect. I'm more concerned about the aspect that when you're here, this could cause a lot of pain in your low back. So if you're doing this on your bed, or even if you're doing this on the floor, it would be good to have a pillow so you could just rest your head down and be in that nice comfortable position while you're stretching that quad. Now, one thing that's really important to watch out for, and yes, I realize I'm putting myself in this position, but it's because I want to be able to see you when I talk to you about it. One thing I want you to watch out for is when you're stretching your quad, you want to make sure that your hip doesn't come up, because if your hip comes up, then you're not actually stretching your quad. Let me show you what that looks like. So you can see as I bring my foot closer to my bottom, if you have really, really tight quads, what will happen is that your hip will start coming up off the mat. And we don't want that, okay? We want to make sure that that hip stays firmly down on the mat while that foot comes closer to our bottom. So watch for that. Make sure you're not doing that. If you are, then you're pulling too hard on that foot. You need to decrease that. Now, starting laying on your stomach, as I just showed you, is my favorite way to start doing quad stretching, because it is the safest for the rest of your body. But for some people, laying on their stomach is really inconvenient, or maybe turning their head to the side for that long is a problem because of neck issues or something like that. There is another way that you can do this, which I'm going to show you next. But with this way, the second way I'm going to show you here, we have to be really, really careful that we're keeping our body in a good position. You see, it's much easier to keep your body in a good position when you have full contact with the floor, but when you're laying on your side, which is what we're going to do next, it becomes a little bit more difficult. So just watch out for that. Okay, now if you're laying on your side, you can do it with a stretch strap or without. We'll show you both ways. If you're gonna do it with a stretch strap, again, I'm gonna have you put your foot in there. We're gonna grab the two ends. We're gonna lay on our side here. This is kind of nice because we can prop up our head here. And then the bottom knee, the one you're not stretching, is going to be bent a little bit forward just to help you maintain balance. Your hips are stacked one on top of the other, and this is really important. Your knee needs to be pointed down, because what can happen is you can try to stretch here, and then it's like, well, that's not getting me a stretch, right? So you need to make sure your knee is pointed straight down from your spine, and then you can pull that strap over your shoulder-ish and find that good stretch. You're going to hold for 10 seconds, and then you can release it and then rest for 10 seconds. And you can do that a total of 3 times. So then you would come up. Remember, knees pointing down, hips are stacked on top of each other while you pull that foot towards your bottom with the stretch strap. Now, for some people, this is actually they have more motion than this, and it's actually more difficult to use a stretch strap with that. So if that's you, I'll just toss it away. And then what you can do is you can actually grab your foot with your hand. Again, you want to make sure that knee is pointed down, and you're going to pull that foot towards your bottom. Now, if this causes any problems with your shoulder, because some people, their shoulder will be forward and then they're like trying to reach back and it hurts, just tuck that shoulder blade back, and that usually helps get a nice little shoulder stretch along with your quad stretch, which that's amazing. And then you can hold for 10 seconds, and then you can just relax it down. Again, we want to make sure that we're doing this without any knee pain. So as you're pulling that foot towards your bottom, you're pointing that knee down, your hips are stacked on top of each other. Make sure that you're not causing any knee pain. If you start to notice anything over the knee, like over the kneecap, what you might need to do is decrease how close your foot is to your bottom, and then you may need to actually push that knee back a little bit more so you get into more of a ballerina type position. This will help to get more of the stretch up on the top part of the quad as opposed to the bottom part of the quad. Okay, so here's my favorite way to do a quad stretch because it is the most flexible and it's the easiest to be able to do. What you're going to do is make sure that you're holding on to something stable. It can be a kitchen counter or a chair or table, whatever, just something stable that you can balance with. And then you're going to do the same thing that we did in side lying, where you're going to grab that foot. You're going to bring it back behind you. Remember that trick of tucking that shoulder blade back behind you so you get a little bit of a shoulder stretch with it. Now this time you're going to try to bring your knees together. I can't completely touch my knees or else it's just too much of a stretch. That becomes a bad stretch as opposed to a good stretch. So I like to leave my knees a little bit apart, but if you need more stretch, bring your knees closer together. And then what you can do is you can bring that knee back behind you. So you're trying to put the knee, so my left knee is trying to go back behind my right knee. And that feels like a really good stretch. That's all the way through my quads right there. So you're gonna hold that for 10 seconds, then you'll relax. In most cases, I will go do the other side as I'm resting because I'm gonna do one side and then the other. So I would just turn. Again, I'm gonna grab that foot, I'm gonna bring my knees closer together, bring that knee back behind me, open up my shoulder so I get that nice shoulder stretch too, and then hold that for 10 seconds. Then I would do that 3 times on each side. Now, some people have asked me, can I use the stretch strap while I'm in standing? And yes, you can. Some people that's a little bit too difficult, but hey, if you want to try it, you can. Here's what that looks like. Okay, so for this one, what I'm going to do most commonly is I'll actually put my foot in one of the further down loops. That way I've got a nice long stretch strap to work with. I'm gonna bring that foot back behind me, bring that stretch strap over my shoulder, and now I'm gonna get in position, knees closer together, push that knee back, and now I can pull that stretch strap to get that foot up. So you can do it with a stretch strap. I feel like it's a little bit more difficult, but everybody is different, so do what works best for your body. Now, a lot of people ask me, what about the lunge stretch for the quadriceps? I'm going to be honest, this is not my favorite quad stretch. And the reason why is because a lot of people, when I see them doing it at the gym or I see them demonstrating it in the clinic, they're doing a lot of things with their low back that could potentially cause problems. And I understand that it may not hurt you now, but I really don't like it as a long-term solution. However, I will show you here, so at least I can give you some instruction on how I want you to do it if you are insistent that that is the best stretch for you. However, it's not my favorite. I would prefer for you to find one of the other stretches. Okay, if you're going to do the lunge stretch, I highly recommend having a little padding underneath the knee just to make it feel a little bit better. So we're going to put this underneath my knee. Then you're going to stretch forward with that front leg, trying to get through that really nice position. So you've got a lot of room here, and then we're protecting the left knee as well. I'm going to have you put your hands on your hips because I want your hips to stay in this forward position. So equal hips here. A lot of people, when I see them doing it, what they do is they end up opening up their hips. And that's when I get really concerned about what's going to happen with your pelvis long term with that stretch. The other concern I have is that there will be too much motion through the lumbar spine, the low back here. So when you're doing this, what I want you to do is keep that pelvis in alignment, and then you're going to lean forward through this. I'm leaning through my left knee until I feel that stretch through the quad. Then what you can do when you get into that position where you're starting to feel it, if you squeeze your glutes, now I've got the stretch through the quad, but I've also got it through that psoas up in here. So I'm adding in that psoas stretch. And then you hold it for 10 seconds, and then you can get out of it. Again, not my favorite stretch. I would really prefer that you try one of the others and see if you can still get a good stretch through your quads like that. So there's several different modifications of how you can do a safe for you quadricep stretch. With all of them, you're going to hold the stretch for 10 seconds. You're going to relax for 10 seconds and then hold again for 10 seconds. You're going to do 3 total stretches for 10 seconds each, making sure that you have a rest time of 10 seconds in between. Now, it's fine if you want to go from side to side. That's absolutely not a problem. That's usually what I'm doing when I'm stretching because I'm trying to kind of get through everything. But if you're using the strap and you're laying down or you're on your side, then it can be difficult to switch from side to side. So in that case, I would just stay doing that one stretch and then I would flip over to the other side or move the strap to the other leg. Another question that I get asked a lot in regards to stretching is, do you stretch before you do your activity? Do you stretch after your activity? When do you feel is the best time to stretch? Personally, I am a big fan of the European method, which is an active warm-up for any activity. So doing your activity actively, but not to full intensity to warm up. And then you can do your stretching once your muscles are warm. Now, for me, I usually go running in the morning, and it's pretty quickly after I've gotten out of bed. So I will do a walking warm-up before I run, and then I'll actually do my stretching after I go running in order to use all that warmth that I've circulated during the run in order to help get a better stretch. And I get it, this is controversial because you've probably been told for your entire life that you should actually stretch before you exercise. However, here's my thought on that. If you're stretching before you exercise, then you're getting your muscles all long and loose and less stable and not contracting as much. And then you're going out and potentially doing a really high intensity exercise. I feel like this can lead to injury. And it has actually been proven when they're looking at sports teams. If you don't believe me, go watch some European football. Now, another question I get asked is how frequently should you be stretching your quads? So you definitely want to do this on a daily basis because you want to keep track of what your quad tension is doing. Because for some people, particularly those who have a history of knee pain or hip pain or potentially even low back pain, their quad tension can vary greatly from day to day. And if you stretch your quads every day, then you notice how that tension changes from day to day, and you can see if those symptoms correlate with any of your other symptoms, which is a good thing because listening to your body can give you a lot of clues about what's going on. The important thing is to be consistent with your program. You won't necessarily see changes after one day or 1 week, but definitely if you've been doing this for a month or a couple months, you should feel that quad flexibility improving, and you'll be able to catch any warning signs if anything starts to go wrong. Listen, quad tightness is common, but not normal. Now, if you're wondering if your knee pain is actually coming from your quads or even from your knee originally, or you're thinking maybe it's coming from somewhere else, I'm going to have you check out this video over here to learn more about knee pain that's coming from somewhere else. Hey guys, if you like this video, give it a thumbs up and don't forget to click subscribe. Are you struggling with foot pain, knee pain, or even cramping in your calves at night? It could all be coming from one thing, and that's your calf muscles. And yes, I did say calf muscles. There's actually 2 muscles in your calf. Most people know about the gastrocnemius or the gastroc. That's the big muscle in the calf. However, there's a sneaky one underneath called the soleus. It's much smaller and much less popular, but it can be a problem for a lot of people. Both of these muscles attach into the Achilles tendon. That's the tendon that runs along the back of your heel and attaches to the bottom of your heel. If you've ever heard of anybody having Achilles tendonitis, that is an inflammation of the Achilles tendon or the tendon that we're talking about here, which means that tightness in the calf and the Achilles tendon can lead to plantar fasciitis, which is pain in the heel that goes along the bottom of the foot, or pain in the knee, especially with walking and squatting. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life, and you deserve both. First off, we're going to start talking about why your calves might be tight in the first place, how the foot and the calf and the knee are all connected, some other things to consider if you're struggling with calf tightness, and then we'll finish off by showing you my favorite calf stretch. All right, signs that your calves might be too tight. If you suffer with heel pain or have plantar fasciitis, it could actually be coming from a tight Achilles tendon and tight calf muscles. If you suffer with knee pain during running or squatting, that could actually be coming from your calf. If you struggle with cramping at night, some people will have cramping that even is so bad it wakes them up at night. That's from your calves. Or if you notice that you tend to walk more on your toes than on your heels, or you're not able to bring your toes back towards your head. That motion is called dorsiflexion. And if you're not able to lift your toes up off the floor or lift up your foot from the floor, it could be due to tight calves. So how is the foot and the calf and the knee all connected? Well, if your calf muscles cannot lengthen properly, this changes actually the biomechanics in your foot. If that happens, it can cause the knee to move incorrectly, trying to compensate for the tightness in the calf and the poor biomechanics in the foot. Or it could lead to limited ankle mobility, which will cause overuse injuries up and down the chain. Now, if you tend to have cramps that happen at night, maybe you're fine during the day, you're like, Dr. Amy, I can pick up my toes from the floor, no problem, but I just get this cramping that wakes me up in the middle of the night. What you may be suffering from is actually a magnesium deficiency. So you may want to be taking some magnesium orally. There's also lotions that include magnesium that you can put on your calves. You still want to be doing stretching before you go to bed to decrease tension in your calves. But adding magnesium can specifically help with those muscles directly. In my house, because we run so much, we take magnesium in the morning and put magnesium lotion on at night. And it's critically important that we talk about the hydration factor. Friends, if you are not drinking enough water, all of your muscles have the chance to become tight, especially the calves. You need to be drinking at least 80 ounces of water a day to ensure that you have enough water to keep your muscles healthy. Dehydrated tissue leads to less flexible tissue. And a lot of people will ask me if they need to add electrolytes. If you live somewhere where it's very hot or you do a lot of activity during the day where you're sweating, you may need to add some electrolytes in order to help that water get properly absorbed. Now, I promise that we are going to talk about those stretches in just 1 second here, but one more thing I want to mention before we do, and that is the importance of the psoas muscle. You see, the psoas muscle is up at the hip. It's actually a hip flexor. So that means bringing your knee towards your chest. That's what the psoas does. So when the psoas is tight, it actually forces your body to lean forward a little bit, which can increase tension in your calves. So you may have less effective stretching in your calves because your psoas is actually tight. Or you may feel like you're constantly trying to stretch your calves, but you're never seeing any improved flexibility. If that sounds like you, we are going to link a video at the end of this one so you can stretch your psoas. But now it's time to show you how to stretch your calves. All right, so this is my absolutely favorite calf stretch. It's the one that I do every single day. And I'm gonna show you first on my right side because that would be my normal side. My left side, I actually sprained my ankle 5 months ago, and I am still working through that. It definitely looks much better than it used to, I can guarantee you that, and I have gotten back to running. However, it's still struggling with some of that calf tightness, which is why I need to make sure I do this stretch on a daily basis. So I'll show you what that looks like from side to side because you may be struggling with some kind of injury like that as well. First off, you want to be somewhere stable just so you have something to lean on. You're not going to be leaning on it very hard, but just to maintain your balance. You're going to put one foot back behind you as far as you need to do that runner stretch. Now this one you've probably seen before. This is not a super unique one. You do want to make sure your heel's down. You can have your foot all the way back here, but if your heel's not down, you're not stretching your calf. So you got to make sure that heel is firmly planted on the ground. And that feels like a really good calf stretch to me. Now here's the secret sauce, friends. What you're going to do is you're going to hold this position for 10 seconds. And then after you do, you're going to keep everything in that same position. So heel still down, everything staying in the same position, and you're going to bend that back knee. Now, when you do that, you're going to feel where you're stretching change a little bit. This stretch emphasizes more the soleus, which is that small muscle that's underneath the gastroc, and it is going to be a game changer for you. I promise, friends. So we're going to do 10 seconds, typical runner stretch. After the 10 seconds, we're going to do that soleus emphasizing stretch, and we're going to hold that for 10 seconds as well. We're going to do a total of 3 cycles of that. Now I'm going to show you what that looks like on my left, because my left is not going to move as well as my right, I don't think. Yep. So right there, it's already harder to get my heel down. Okay, so that's my typical runner stretch. Actually, I'm going to move that up a little bit because that's just feeling like a little bit too much of a stretch. And I know I'm not going to have any flexibility to bend my knee. After I've held that for 10 seconds, I'm going to bend that back knee. Now you can see that's just a little baby bend, right? There's not much happening there, but I can tell you I feel a pretty big stretch with that. And I'm going to hold that for 10 seconds, and then I'm going to switch back 10 seconds. This is emphasizing the gastroc, and this one is emphasizing the soleus. Now, a lot of people will ask me how many times per day should I stretch my calves? Since it's a pretty simple stretch to do, when I am really struggling with one side being really particularly tight, I'll do it several times through the day. I'll do it usually about 3 to 5 times per day to make sure that I'm keeping that calf super flexible and healthy. But for you, if your calves are overall pretty normal, I want you to make sure that you're doing it at least once per day. And I want you to notice if it changes from day to day. So with my calf that I sprained, after I go running, it definitely gets tighter. So on days that I run, I have to stretch it 3 to 5 times. However, if I don't run for a couple of days, usually I just have to stretch it once, and then it stays pretty flexible throughout the day. Now, if you are someone who's like, that's great, Dr. Amy, but I've been stretching my calves for months, years, decades, and I still don't find relief that lasts for long term, then I'm going to have you check out this video over here, because that's where we're going to be talking about how your psoas tightness could be leading to your calf tightness and what you can do to treat that psoas tightness. If this video has been helpful for you, please give it a thumbs up and don't forget to click subscribe. Are you still trying to stretch your IT band with foam roller or yoga poses, but not feeling any relief? In fact, you may actually notice that your pain seems to get worse after you finish doing your yoga or stretching with the foam roller. Today, I'm going to show you why that's not working and what you can do instead. First off, let me say, I understand that this is a controversial video. There are many, many people out there on the tubes of you who assume that you can stretch your IT band and will give you 5 million ways to do it. Before you comment about this video, please watch it until the end so you can at least understand what I'm talking about here. And then also consider this question. If you have been foam rolling your IT band or doing yoga poses to help your IT band and continue to suffer with IT band pain, then let me ask you to consider if this is actually working for you. However, if you are someone who's been foam rolling your IT band and been frustrated because that's the only information you can find on YouTube, then let me tell you, you are in the right place, because I'm going to give you other ideas that you can do instead. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life, and you deserve both. First off, we're going to discuss what the IT band is and why it feels tight in the first place, which will lead us to why IT band stretching doesn't actually work, what's really causing the problem, which will naturally lead to what you should be doing instead. Okay, let's discuss what is the IT band in the first place. So the IT band is a thick piece of fascia that has its own special name. Now, fascia we have from the top of our head to the tip of our toes. We have it all throughout our body. It helps hold our organs in place in our abdominal cavity, and it's a very important part of our body. When there's a thickened piece of fascia, it gets a special name. So think of the IT band in this case, or the plantar fascia. You may have heard of plantar fasciitis. That's an irritation of the plantar fascia, which is a thickened piece of fascia that has its own special name. If you're not familiar with fascia, if you think about a raw steak and you're trying to tear the fat off of the meaty part, and there's that thick, white, stringy stuff in the middle that makes it really difficult to tear it off, that, my friend, is fascia. So this IT band, or this thick piece of fascia, gets tight, and people feel like they need to stretch it in order to get it to loosen up. However, there's 2 important facts here. 1, fascia doesn't stretch, and 2, fascia doesn't like it when you try to stretch it, because what happens is it will create micro trauma, which will actually lead to more sensation of tension. Again, I get that this is all controversial, and this is not what everybody's saying. However, if what you're doing is currently working, you're probably not going to be watching this video in the first place. So stick with me and hear it out. Okay, why stretching the IT band doesn't work in the first place? Well, because the IT band is made up of fascia and it's not a muscle. So muscles have muscle fibers and they contract and they relax. They contract and they relax. So when you stretch, it helps to relax the muscle fibers. Well, fascia does not have that contractile unit. So when you try to stretch it, it's basically causing a tearing because it can't actually loosen. It just creates micro tears to try to make you happy and feel like something happened, which is why it might feel better in the short term, is because you're like, oh, okay, something happened over there. However, in the long term, the body has to now repair those micro tears, which leads to more of a sensation of inflammation or tension. Aggressive foam rolling can also lead to increased inflammation, which means it will feel good maybe in the short term. Okay, I know it doesn't feel good while you're doing it, but it feels good right after you're doing it because you get more blood flow into that area because it caused inflammation. However, it's not a good inflammation, and so it's not actually going to help heal the area. So when you have pain or tightness in the IT band, or even it may be on the outside of your knee, because that's where the IT band inserts into, chances are good that it's because of a muscle imbalance and not actually because of a tension issue in the IT band. Which leads to our next discussion, which is what is really causing this problem. So to discuss that, we need to discuss where the IT band originates from. So the IT band originates from a group of muscles that are up in your hip. So if you put your hand on your hip, you're actually putting your hand on all those muscles that attach into that IT band. Now, when those muscles are not functioning correctly, it causes the IT band to become tight to try to compensate for the muscles. Now, that doesn't actually work. It just causes pain and tension and makes you feel uncomfortable. However, the body's doing the best it can. Most commonly in the clinic, what I see is a weak gluteus medius. So your gluteus medius is the muscle that kicks your leg out to the side. It's called the hip abductor. And when it gets weak, you may have difficulty kicking your leg out to the side. The other thing you may notice is that when you walk, your pelvis is not able to stay stable. So you walk like that model, walking on that catwalk because your hips are dropping, but that's actually not good for you, and it definitely can cause problems in your low back. So we need to fix that. Sorry, your modeling career may not take off the way you intended. Now, another muscle that attaches into the IT band that can often be a problem is a muscle that's more in the front of the hip. So again, you put your hand on your hip, you're putting it right on your gluteus medius, and your fingertips, if you squeeze your fingertips a little bit, your TFL is going to be underneath that, the tensor fasciae lata. That muscle helps to actually bring your knee to your chest. So it's actually one of the hip flexors. And so it gets really tight when there's a muscle imbalance in your hip, most commonly due to weak glutes. So if the muscles in the back of your hip, so now you're going to put your hand on your behind, those muscles back there, if they're weak or tight or just not activating properly for some reason, chances are good that your TFL along with your psoas, which is another hip flexor muscle, are going to become tight. And when they become tight, now, this is a muscle we're talking about, right? So they become tight, they become functionally weak. So you may feel like, oh, my hip flexors, when I try to bring my knee to my chest, it's really weak. And it may be authentically weak. However, it may also be functionally weak in that it's stuck together. So it's stuck in that contracted position and it cannot relax, which means it has a mechanical disadvantage. And the last thing, which I don't want to overlook, is that you may have a pelvic malalignment issue. So your pelvis, when you put your hands on your hips, your hands may not be at the same height. And the problem with that is that causes all of these other things that we were just talking about to become an even bigger problem. And most of the time, when I have people come in who have an IT band tension issue, they have a weak glute maximus, they have a tight TFL, they have a tight psoas, and they have a pelvic malalignment. So it doesn't have to be one. Often these guys can all occur together. But the reason why I want to point out that pelvic malalignment is that if that's you and your hips are not at the same height, what will happen is if you try these exercises and stretches that we're going to discuss next, you'll find that it maybe aggravates the problem, but it definitely does not solve your problem. So if you do the stretches and the exercises that we're going to be talking about next, and they're not benefiting you or even making things worse, please make sure you see a manual physical therapist who can address any underlying issues that you have that are leading to this malalignment issue or this lack of strength issue, which is showing up as an IT band issue, but it's not really the root of your problem. Okay, so if you're not supposed to be doing yoga poses and you're not supposed to be doing foam roll stretching, then what are you supposed to be doing? Well, of course, we want to deal with the root of the problem. So it's identifying which of these issues is bothering you and dealing with that. All right, so if we have a tight gluteus medius, so gluteus medius is right here. Remember when I was saying put your hand on your hip? So if you put your hand on your hip, your gluteus medius is here, your TFL is up in here. All right, that's your hand on your hip. So if your gluteus medius is weak, there's things that you can do to strengthen that. Now remember, the first thing we talked about is the fact that the gluteus medius kicks out to the side. So this is something you can do to strengthen your gluteus medius. Now, if you feel like doing it in standing is not enough work for you, then you can lay down on your side and you can kick your leg up to the side, and then you'll be doing it against gravity. Usually I recommend doing 2 sets of 20 on each side. If you can do that with ease, then go ahead and lay on your side so that you can do it that way and get gravity to be giving you a little bit more resistance. But if it's tight, what you need to do is stretch it. Now, this will not actually stretch into the IT band, although you may feel it into the IT band. You may feel it stretching down there. Our goal is to stretch the gluteus medius up here. So what you're going to do is you're going to cross one leg over the other. And I like to hold on to something just for a little bit of balance because why not? And then you're going to stick your hip out to the side. Now, when I do this, I can feel it stretching from here, probably down to here. Sometimes when my IT band is really tight, I can feel this all the way down to my knee, but I'm not trying to stretch the IT band. Got it? You need to feel that stretch up in here. Now, for some people, they're a little bit more flexible up in here, so you may need to stick it out more. Okay, now for me, I get a lot of that into the IT band, which is not what I want. So I would want to stay up in this region up in here. This is a better stretch for me, but just know you can go deeper if you need to. Now, I will be honest, for some people, I have them just cross one foot over and they just go boink and stick that hip out to the side a little bit. And they're like, I feel it. It's like, that's a massive stretch right there. Again, do what feels like a good stretch for your body, not a painful, I have to hold my breath because it hurts so much stretch. Got it? It's important to do the right stretch for your body. You want to hold it for 10 seconds, then you can switch over and you can do the other side. Stick those hips out to the side. Again, see, different from side to side. So when I come to this side, I'm getting a little bit more resistance. This IT band is a little bit tighter. So I'm getting a little bit more resistance, a little bit harder to get into that position, but there we go. Okay, now I feel it up in here and not so much down in there. But again, you may have to kind of work around with it. Every body's a little bit different. So make sure you find that stretch that works for your body. 10 seconds to each side, 3 times. Okay, but you may be saying to yourself, Dr. Amy, it's not so much my gluteus medius that feels tight, it's that TFL, rectus femoris, psoas, it's these guys in the front. That's a bigger problem. Then for you, what I am going to have you do is I'm going to have you, again, hold on. So you've got some balance. You're going to grab your foot, bring your knees close together. And then what you're going to start to do, so you're thinking, oh, this is a quad stretch, and it is a quad stretch like this. However, if we push this knee back behind the other knee, it becomes a psoas, rectus, TFL, all these guys in the front get stretched as well. So if you feel like your IT band tightness is coming more from tension up in here, that's going to be the stretch for you. You're going to hold it for 10 seconds. I would still do both sides, even if you only have a tight IT band on one side right now. Why not do both? And I would do 3 sets of that. Okay, now if you're like, Dr. Amy, it's my glutes that are tight and that's the problem, then I'd recommend the figure 4 stretch for you. For that, you're going to be laying on the ground. You're going to put one foot on top of one knee. And then for some people, that's enough of a stretch. If that's you, go ahead and hang out here for 10 seconds. If that's not you, you can push this knee away. And that may be enough of a stretch for you. If that's you, hang out here for 10 seconds. If not, and you need to ramp it up a little bit, then you can go ahead and bring this knee to your chest. And that should be a really, really good stretch for you. If that's still not enough of a stretch for you and you feel like you need a little bit more, if you move your foot up or down, it changes how you feel the stretch in your hip. Now, I don't recommend moving it up and down. I recommend finding that spot like, okay, that's a good stretch for me, and holding that for 10 seconds. And then I would go ahead and do that on the other side as well. And you may find that each side is different where you feel like you need that good stretch, and that's fine. Do what feels best for each side to get the stretch you need. You'll hold this stretch for 10 seconds on each side and do 3 reps. Now, if you're like, well, Dr. Amy, my glutes are not tight. They are weak. Then I got one for you guys. What you're going to do is you're going to do butt squeezes. So you're going to squeeze those cheeks together. Hold on. I got to focus on this one. There we go. You're going to hold for 10 seconds, and then you're going to relax. So you're trying to do 10 reps with 10-second holds to get those glutes really squeezing. Now, here's why I really need to pay attention when I'm doing that, is because we don't want to be activating the hamstrings. Well, hold on. Let me change that. We do have to activate the hamstrings because they're going to work together, but you can do it with your hamstrings or you can do it with your glutes, and we want to be focusing on the glutes. Let me see if I can show you what that looks like. So if I'm doing it with my glutes, I'm going to squeeze my glutes together, and you'll see more of that coming through here. Now, if I do more through the hamstrings, then it becomes more here. And so I get more of this tilt here, and I know it's a small motion. I do apologize. I realize it's hard to see on video. But when I get my hamstrings involved, I have more of this. Whereas when I get my glutes involved, there's less of that. Okay, so there's less of this tilting happening in here. So you want to be squeezing those glutes and not as much the hamstrings. Now, the hamstrings do contract, but not focusing on those. Holding it for 10 seconds. 10 reps of those. Now, if you're like, okay, I can do that, and that doesn't feel like enough of a challenge, then it's time to ramp it up and to do some bridges. If you're going to do that, you're going to squeeze those glutes first, and then you're going to lift up. Make sure you keep those glutes squeezed so you're getting that work coming through here, and then slowly resting back down, keeping that glutes engaged while you come all the way back down so you don't have that low back taking too much of the stress. If you're going to be doing bridges, I want to make sure you do them very, very carefully, making sure that you're focusing on the glute activation. What I will often see is people will do bridges and they'll just kind of be going up like that. And it's like, well, you're not really getting that glute activation very well, and you're putting a lot of torque through your low back. So glute activation all the way up, glute activation all the way down. Who is this particularly important for? If you are a very active person, if you like to do yoga, if you like to run, if you like to cycle, you're regularly involved in team sports, or you're just someone whose IT band gets aggravated no matter what you do, you're going to want to implement the exercises and stretches in this video that are most effective for you. And if you watched all the way this far and you're still skeptical about if these will work instead of foam rolling, I'm going to ask you to try it out. Give it a 1-month trial. Find the stretches and exercises that are working for your body. I understand every body is different. Find the ones that work for your body. Don't foam roll for a month. Do these exercises for a month. And try it for yourself and see if that helps decrease your IT band tension. But the one thing I can tell you is that if you've been foam rolling for days, months, or years and not found any relief, then that clearly is not the tool that's working for you. So stop trying to stretch what doesn't want to be stretched. I look forward to hearing your stories about how you are a former foam roller as opposed to a current foam roller when you're trying to treat your IT band. Now, if you're someone who has that knee pain on the outside of your knee when you are trying to climb upstairs, I'm gonna have you check out this video over here. Please give this video a thumbs up and don't forget to click subscribe.